standing. Okay, take a picture of that. Then take the ruler, move it to the inside of the foot, and place it up and down so it's measuring the height of their arch. Take a picture of that. Those two pictures, then, they can just send them to the printer, email them to themselves and print it off. That's measurement of the foot. Okay, so I used to have just a very cheap digital camera in my practice, and I used to do that with every patient. I would snap those two pictures of their foot. Actually, I used to have my assistant do it, to be perfectly honest. They did it as part of the gait scan protocol. And she would just print it off when she printed off the gait scan report, and we would send that in. So if you get a rejection on that, if you start to get a couple of them, you might start making that part of your overall protocol. Okay, I'm going to take one more question before we sign off. What conditions are qualified for orthopedic shoes? Again, there's no list, but place yourself in the seat of the adjuster. It has to be a proper diagnosis. Let's put it that way. A proper diagnosis is some kind of pathophysiology, which means it's some kind of inflammation, it's some kind of injury, there's some kind of damage or distortion with the tissue or the bone. Okay, so flat feet is usually flat feet, that's an exam finding. Okay, that's not a diagnosis. Some kind of tendinitis, some kind of sprain, strain, repetitive type injury, chronic inflammation of the soft tissue, that's a diagnosis. Okay? So you could say in a way,